Welcome everybody and give them a couple minutes. Is that okay, Rachel?
Yes, we can give big folks a couple of minutes and
Okay.
I think we can get started since it's 12:30. So I want to be mindful of the time.
Okay, it's 12:30, everyone. Welcome. We're going to give everybody maybe 60 seconds or so to kind of come on in and then we'll get started, but welcome. Welcome, everyone. We'll give everyone maybe another half a minute or so to get started. Because we're on a little bit of a tight timeline here, we'll go ahead and get started. Hello, everyone. Welcome to our nursing Lunch and Learn. Glad to have you. Today's topic, coordinating asthma care within the schools setting. We definitely have an expert in this area. My name is Felicia Fuller. I am a longtime member of Chicago Asthma Consortium, now the vice president of the board, also working for myself at a nonprofit consulting area, as well as grant writing for the Chicago Asthma Consortium as well. So welcome and thank you for joining us today. Next slide, please. So today's quick agenda, but very much packed. I'm going to do a quick CAC overview for those new to knowing anything about what we do and the speaker information. I'll talk a little bit, then hand it over to Gloria Barrera, and she will give her presentation. We should have some time at the end for questions. Please feel free to put any questions, thoughts, or comments in the chat while she is presenting. So, what's our mission? We seek to improve quality of life for those with asthma through advocacy, education, and collaboration. Very short, sweet. But our purpose is to bring together medical and public health professionals, business leaders, government agencies, and community based organizations and individuals dedicated to raising awareness of asthma and improving the quality of life for those who are burdened by asthma. You want to help us make an impact? Of course, you can learn more at our website, chicagoasthma.org. Please feel free to visit it to get more information. Next slide. Quick housekeeping, networking, and communication. Like I said, use a chat feature to please introduce yourself and say hello to everyone that's there. If you have any questions, again, please put that into the chat. We will be minding it and asking questions at the end. And as all good public health professionals demand is an evaluation, so we can tweak our events for the better and change and edit and as needed. So please make out the evaluation that will be provided in the chat at the end. So, how can you volunteer or how can you become a member? Well, for sure, you can email us at info@chicagoasthma.org. But these are some of the committees that we are always looking help and volunteer help with. One of them is our community advisory board, our community engagement. We do fundraising, membership, professional development, and our new one that we're very, very proud and excited is getting off the ground as policy and advocacy, where we really are trying to make sustainable changes in how policies and things around asthma can be put in place to assist those vulnerable in populations. Next slide. So, not a member yet. As you can see, our QR code is right here. If you would like to get a Snapchat up or a snap of it, sorry about that. But these slides will be available too. So there is no rush, but we do have this code that is available that'll take you right where you need to go. And without further ado, I want to introduce our speaker, Gloria Ibarra, MSN, RN, PL-CSN, currently works as a certified school nurse at a public high school outside of Chicago, and she's also a visiting professor of nursing at the University of Illinois, Chicago. She's committed to being a lifelong learner, continues her efforts in improving child health incomes in our most vulnerable populations through her current practice of advocacy and teaching. She was the first Latina president of the Illinois Association of Nurses and served during the pandemic, which I'm sure was very challenging. She's engaged with the ANA Illinois by serving on the executive board as secretary. Gloria is appointed to the IDPH Diversity in Healthcare Professions Task Force, as well as the Governor's Illinois Terrorism Task Force's School Safety Committee. She has demonstrated her deep commitment to helping others through her volunteerism and community service with various nonprofit organizations where she shares her expertise and serves as a leader. She is a fellow of the Alliance of Nurses for Healthy Environments, a climate health organizing fellow, and a co-founder of Nurse Heroes for Zero. She is considered a subject matter expert in school nursing, environmental advocacy, and health equity and public health. Definitely a person that we need in our world and in Chicago, especially. So, without further ado, I'm going to hand it over to Nurse Barrera. Hi, Gloria.
Hello, thank you. Let me just quickly set up my slides here. Um, Let me know if you can see at least one slide for right now.
Yes.
Okay, let me just fix that so that it's aligned there. Good. Good afternoon, everyone. And thank you for being here. 30 minutes, it's going to go by fast, but to all the nurses that are joining, Happy Nurses Week. If you're seeing that this after being recorded, Happy Nurses Week, you deserve it and really so much more. So please throw in the chat, the 18 of you that are here, if there are any freebies that we can all benefit from, please. I'm all for the free coffee. So please, engage and share what freebie you know about. But today we're talking about coordinating asthma care within the school setting. But I want to be very clear from right now, from the start, that this is not just about asthma. This is about access. It's about systems, and ultimately, this is about whether a student can sit in a classroom and breathe without having that fear that they're going to have an asthma attack. Because when a student can't breathe, they can't learn. We can't educate, students that are not healthy and ready. And because when a student cannot breathe, then they can't progress further on into thriving, right? And so what we do or don't do in schools directly impacts that outcome. And we're gonna look here now at why this matters. I think that you already know that, but asthma is one of the most common chronic conditions affecting children. Nationally, millions of children are impacted, and it remains a leading cause of school absenteeism. But what often is missed is this. So asthma is not just a health issue, it is an educational issue. Students with uncontrolled asthma, they miss more school, they perform lower academically, and they participate less in physical and social activities. So the data shows us very clearly that when asthma is controlled, then those barriers disappear. So the reality in schools, let's talk about what we actually see. Now, I'm not talking about what's ideal, but what's real right now in our, school buildings. We see students who are undiagnosed. We see students with outdated or missing asthma action plans. We see inhalers locked away when seconds really do matter. And what the Asthma Friendly Schools Toolkit tells us is that even one gap just one, can make asthma harder to control in schools. So, what we are really dealing with is not just asthma, we're dealing with fragmented systems right now in many schools across Chicago, across Illinois. So your role as the school nurse is really one that closes those gaps. We are not just responding, we are coordinating. And according to the National Association of School Nurses, care coordination is about aligning multiple components of care to support both health and academic success. So we really are bridging healthcare and education. We are leading clinical decision making in real time, and we're building those systems when none really exist right now. And more importantly, we're seeing the whole child, right? We all know about that whole child framework. So, what is care coordination? Care coordination is not a task. It's not just one more thing to add to your plate or to your, list of responsibilities. It is a system. It means that the provider is aligned, whoever that provider is, if it's a DO, advanced practice nurse, if it's a MD, whoever that provider is, it's aligned. They are aligned. So the family understands the plan, the asthma action plan. The school is prepared to act. So it's being proactive, it's not being reactive. And when done well, it connects the home, it connects the school and that healthcare into one continuous system of support. That's care coordination. So, what are core components of asthma care in schools? Effective asthma management in schools rests on four pillars, and you'll see that here: asthma action plans, medication access, trigger management, and staff awareness. These are not optional. They're very, very clearly outlined that these are essential components of a functioning asthma program in schools. So if one fails, then the system weakens. So if multiple fail, then you can see that the student really is at risk. So let's look at the asthma action plan. That really is our clinical, backbone right now. It provides daily medication management, daily management guidance, clear steps for escalation, defined thresholds for emergency care for that student, and it must be, current. It has to be accessible. It can't be locked away somewhere. It has to be understood by staff. And without it, staff are forced then to make clinical decisions, either if there's a sub nurse, without clear direction. So that really is not safe practice. Um, Looking at medication access really is everything. Students must have immediate access to quick relief medication at all times. So the guidelines are very clear. Access must extend beyond the nurse's office. So it must include school events and transportation, for example. Self-carry should be supported when appropriate. We have laws to support that here in Illinois, because here's the truth. An inhaler that exists but cannot be reached, it's the same as having no inhaler at all. And by now, we are very familiar with the Rescue Illinois program. All Illinois public schools have access to rescue inhalers through the AIR program, the rescue program. So, communication gaps. Most failures in asthma care are not clinical, they are communication failures. So, what does that mean? Families may not understand expectations. Providers, again, it could be an MD, a DO, advanced practice nurse, physician assistant. Providers may not communicate those updates. Staff may not know how to respond. Staff meaning administration, your coaches, your athletic trainers, teachers. And the National Association of School Nurses emphasizes that, again, breakdowns directly impact safety and outcomes. So when we fix communication, we really are improving care. Strengthening communication. So, what does effective communication look like? It's structured, it includes standardized forms, it includes really defined workflows, regular follow-up, and most importantly, it's consistent. It's not dependent on memory, it's not a people process. It's not dependent on any one individual, but it's built into the system. And let's look at triggers in the school setting. So the school itself can be a trigger. According to NAEPP, that toolkit, common triggers can include poor indoor air quality. It can include cleaning chemicals, exercise, outdoor allergens. And here really is the shift. It's that we do not just manage the student, we really are managing their environment. So we have to look at the exposure because that really does drive the symptoms. And we can talk more about that after. So recognizing and responding to asthma episodes. For the nurses that are joining, this is geared for you, but you should already know this. This is part of your clinical background, clinical expertise. Early recognition really is critical. Even mild symptoms can signal a worsening episode. So if you see symptoms, please act quickly. That means recognizing early signs. That means following the action plan, administering the medication. And if you have that rescue inhaler, if that child does not have the medication, then you're following the rescue protocol. So escalation when needed, it's activated, right? So consistency really does save lives, and making sure that you're prepared and annually are looking at your skills and refining them, and just being up to date with what's happening with the asthma education. So let's look at a case example when the system fails. Let's just walk through, this is a simple scenario. You can apply it, and we can discuss about other scenarios that you've either seen in your practice or that you want to talk about. So a student arrives at school. It's high pollen day. There's no action plan. The inhaler is not accessible. So they begin coughing in class. What happens? Let's say the nurse is out and there's a sub, there's a delay, there's confusion, escalation is maybe delayed there. So this is exactly what the guidelines warn us about. When systems fail, outcomes then worsen. So now imagine that same student with a coordinated system, with that coordinated system that I just discussed a few slides ago, the rescue program in place, and multiple people in the school trained on how to use the rescue inhaler. I don't know if he's here today, but shout out to Mark, I think it's Ruben, for always bringing up the coaches, right? Yes, we want everyone trained, but unfortunately in Illinois, unless there's a clear mandate, a mandate from the State Board of Education, a mandate from IHSA of training, we have to accept those that are interested at will to be trained. So when there's that coordinated system, again, everything changes for the better for this student, for all students. So what works? That coordinated approach. When care is again coordinated, the plan is current, medication is accessible, staff are fully trained, communication is then, aligned, and the outcomes are measurable. Fewer symptoms, reduced absenteeism, which is what all administrators in CPS, but across the Illinois are really concerned about. The absenteeism rate, improved participation, and then research really does show that effective school-based asthma programs improve both health and academic, outcomes. So this is not theoretical. This is not just something that you're reading on a slide. This is proven. It's proven, year after year. So the key takeaways, because we do want to leave it open to questions or to discuss any kind of case scenarios or to discuss freebies in the chat. I want to leave you with three things. First is access prevents emergencies. Access prevents emergencies. If a student can get medication quickly, we prevent that escalation. Second is communication. That communication drives the safety. When everyone knows their role, response barriers are immediate and effective. Third is the coordination improves outcomes. So you heard that word all throughout, coordinated and coordination. So not just in health outcomes, but also in academic outcomes. And I'll add just one more, and that's the school nurse is the system. The school nurse has to be part of that system. We are that connector, we're the coordinator, we're the advocate. If I have people on here that are not school nurses and maybe just advocates, I would challenge you to ask who is your school nurse? Who is your child's school nurse? If you have a family member, everybody has kids, around them. I don't know if it's a nephew, a niece, if it's, just your neighbor. Who is the school nurse? If your child or if that child in question that you're thinking about does not have access to a school nurse, you're going to have to ask why not. Because access to a school nurse in the school building every day should not be determined by a person's zip code. And unfortunately, that's the state in many cases. And I just want you to be advocates in that way to just challenge that system, challenge that status quo, and ask, where's the school nurse and why don't we have one? Because there's an influx in students with asthma, but also an influx in students with a lot of other health concerns that are in schools every single day. So students do not just survive the school day when there is that school nurse. They really do thrive in it because every student deserves to breathe easily and learn fully. So with that, we do have 10 more minutes to open it up to either we're discussing case studies or whatever else you may want to discuss. But I know I spoke fast. So if you need me to go back to a slide as well, please let me know. Here are my references, and you'll have access again to this recording. I will stop sharing.
Right.
Thank you. And I'm just looking at the chat here. So Cindy, hello. Thank you for joining from the American Lung Association. Happy to have you. Happy Asthma Awareness Month to you all. Thank you. Thank you so much, Cindy. Did you want to share some free resources that you have with the American Lung Association, please? I know that I'll be joining in on one of the trainings as well. So please go ahead and share. You have the floor.
Hi, can you hear me okay? Oh, wonderful. I love your presentation. Thank you so much for the opportunity to listen to these good things. But actually what we have is the American Lung Association is doing in advance of the end of the school year, an opportunity for school health professionals to receive free scholarships to our training programs that are school-based, our open areas for schools, kicking asthma, our Asthma Educator Institute, which has 14 nursing credits attached to it. So if you're looking for credits, that's a good one too. Um, and free flip charts, which is a educational tool that is great for self-management education on the fly in your office.
Is
So
that
I
what's
put
behind you right now, Cindy?
it
The flip
is,
chart?
yes.
Can we see it?
Yes, of course. Of
Show and
course.
tell.
So it looks like
Look
this.
at
It's a
that.
physical stand up and it's
Yeah.
laminated.
Hmm. That
And
is
then
nice.
what you do is you flip and the student sees this or the parent, and then the
Okay.
back is the script about the content. So it keeps it nice and consistent and
Hmm.
it covers all the different areas of asthma. So if it's medication that you're talking about, if it's an asthma action plan, if it's environmental triggers, whatever the topic at hand, there is an opportunity for that.
Wonderful. And how do folks get that? You said it's free, but how do we get that?
Yes, it is free. All we need to do is complete an email to us at lungfriendly at lung, yes, lungfriendly at lung.org, which I put in the chat.
Wonderful. Okay. You heard it here. That's a freebie. Thank you.
And
That
please
is
share it with
definitely a
anybody else
freebie.
that you're looking for.
Yeah, we'll have to make sure to include that
Thank you.
in the caption. That's great. Thank you. Bridget, you're most recently a school nurse, now in a disease management consultant role at Lurie's Children's Hospitals. Hello, thank you for joining. Um, and Wanda, you shared the flip chart. Perfect. Thank you. Any other scenarios or any tidbits that you'd like to share with us? You can come off mute. We have about 5 more minutes.
Victoria, can you speak a little bit? I know you touched on this, but I know Chicago has a serious issue with um, not having nurses in every school. And you really commented, which I appreciated, how important nurses are, not just to breathing, which is primary, but to academics and even sports, which is important to many children and high schoolers. There was a time when there was one nurse to five schools in Chicago, and that's just a most hideous statistic that is out there. Can you speak to that? And I'm sure our greater suburbs are not, that much better, at least some of them
Hmm.
probably. But can you speak
Yeah,
to that
well,
just a little bit more?
yeah, I can't speak to CPS, the way that they assign their nurses, the ratio. I don't work there. I haven't seen their workflow, the processes. But what I can tell you is that we are doing a capacity study right now. So, under my leadership through the Illinois Association of School Nurses, we were able to get funding through the State Board of Education, with ESSER funds to do a school nurse capacity study. So instead of us saying we need more school nurses, we need more school nurses, we did not have the data to support that. We didn't know who was working where or how many schools that one nurse was, responsible for. We didn't have the data because there's never been a capacity study in the state of Illinois for school nurses specifically. So now that we have the funding, we secured it. That study is underway. So from those results, we'll be able to more clearly advocate for what it is that we need. And it's not ratios. So it's not, I know that there's a national ratio out there of one school nurse for every 750 students, but ratios don't work when we don't factor in acuity. Those 750 students could be a K through 3, school in rural Illinois that, is fine being managed by one school nurse. But take that 1 to 750. The 750 is maybe a co-op school that has K through 8 students with behavioral needs. There's G-tube feedings. There's, whatever it is, add all of that to it. That's not going to be enough, just one school nurse to those 750 students with the acuity being high. So I can advocate to move away from that, to move away from the 1 to 750 ratio and to look at more of an acuity model. So we'll be able to, I think next year, when we're in session, legislative session, we'll be able to more forcefully advocate for a school nurse in every building based on
Yep.
acuity, what that looks like. Because I
Mhm.
think there's just a lack of awareness. And when I say lack of awareness, I don't mean with healthcare professionals because that's a given. Yeah, why isn't there a school nurse? But what I mean by lack of awareness is the public, because some people are impersonating nursing. They're impersonating. It's a secretary saying, "Oh, that's the school nurse," and she's not correcting, people, knowing that there is no background in nursing. There is not even, an LPN in her background. She just might be a secretary, and
Right.
they had seen her as a school nurse, so she's going with that.
Mhm.
But also, there's no awareness with parents, because I think once there is an awareness, this is not going to be an ongoing topic anymore. You wouldn't see that or allow it in the hospital setting. So let's say a secretary strolls into a pediatric unit, right, into a room, and you and your child are there, and they say, "Well, the nurse is not here." The nurse is not here right now, but I'm going to be administering your medication. I'm going to be giving you your inhaler. We would not allow that. There would
Would
be,
not.
something splashed on the internet. There would be an uproar. There would be a legal battle. And it would be talked about, and that person would be fired, right? Like we would never allow that as a society, but we allow that every single day in schools. The nurse is not here right now, but I'm going to give you your medication. And that's just because there's no awareness. So I think that that's where we're at, and we have to do better. And I think we're going to have those tools to do better next year. Any other questions? Thank you, though, for that for that question. It was not an easy answer.
No, it's not an easy,
No.
situation either. And
Mhm.
but I'm glad that, we're thinking about ahead and how we can affect policy.
Yes. Well, it is 1 p.m. and I know that we have the the link in the chat. So if you could please make sure that you complete it so we can bring you the best topics for next school year. And again, all of the school nurses either on here right now or watching this after it's been recorded. Happy Nurses Week. Thank you.
Thanks all. We'll stay on a second so you can click that for the evaluation marker.